Hello and welcome to Health Bulletin. And today we're focusing on an issue that's affecting millions of people worldwide, but is still shrouded in mystery: long COVID. Doctors in India are struggling to diagnose and treat patients suffering from long COVID, and there's a reason for this. The guidelines are limited, the research is scarce, and the burden on the healthcare system is immense. Even though the World Health Organization has declared COVID-19 no longer a global health emergency, for many, the aftershocks of the pandemic are far from over. Long COVID refers to lingering symptoms that affect various parts of the body, lasting well beyond the period of acute infection. The most common symptoms include a persistent cough, muscle and joint pain, overwhelming fatigue, brain fog, and difficulty focusing. Let's talk numbers. A Harvard Medical School study published this year in the International Journal of Infectious Diseases has highlighted the global footprint of this condition. According to their research, 31% of those who were moderately or severely infected in North America experienced long COVID. In Europe, the figure jumps to 44%, and in Asia it's 51%, while another new study from NDorms sheds more light on this situation. It turns out, post-acute infection syndrome, or PAIS, isn't just a COVID story. It's a sequel to other severe respiratory infections as well. The study published in JAMA Network Open examined over 190,000 participants from the UK Biobank. Dr. Junqing Xie, who led the study, says it all. The post-acute effects of COVID-19 are not unique. They can also occur with other severe respiratory infections. COVID patients, however, are at a higher risk. 23 out of 45 symptoms were more common among those hospitalized with COVID. Closer to home, an Indian study found that 45% of recovered COVID patients were still grappling with symptoms like persistent fatigue and a dry cough. Doctors in India are reporting a rise in patients complaining of symptoms that didn't exist before their COVID infection. Things like asthma-like conditions and neurological complications. But diagnosing long COVID isn't straightforward. There's no specific biomarker test, no gold standard diagnosis. Right now, it's mostly about assessing clinical symptoms and quality of life. Experts are calling for more studies that delve into sleep disorders, the biological underpinnings of long COVID, and targeted interventions to help these patients get their lives back. And amidst all this, a glimmer of hope. Scientists at Indian University have developed a fluorescent probe to detect inflammation in the brain caused by COVID. This probe measures nitric oxide levels in microglia cells, showing that research is advancing, albeit slowly. New studies are our best hope to unlock the mysteries of long COVID. We need them, urgently. We need to study the biological processes at work and develop focused interventions. As it stands, it's too soon to say we fully understand long COVID. The Indian medical community is still awaiting more focused research to address the growing recognition of neurological complications in patients. But there is some hope. It's a step in the right direction, but it's just one piece of a much larger puzzle. And the puzzle is still evolving. Long COVID is an unfolding story and will continue to bring you updates as new studies come in and new solutions emerge. Stay with us on Health Bulletin as we track this issue, because it's not just about surviving COVID-19, it's about truly recovering from it.